Imagine that you're in a pizzeria. The smell of pizza makes your mouth water as you survey the menu. Should you order pepperoni? Meat lovers? What about buffalo chicken or veggie supreme? As you place your order, you notice the worker behind the counter seems tired and a little pale. 10 minutes later, he calls your name. He smiles at you as he takes your payment and hands you your order. You walk away with your pizza, eager to dig in. 2 days later, you don't feel so good. Your stomach is killing you, and you keep throwing up. You stay in bed most of the day. Within a day or two, your strange illness passes. Later, you learn that you had food poisoning, and it's likely the pizzeria worker gave it to you. That day in the restaurant, he was sick with diarrhea. A few hours before work, he threw up. He was feeling better by the time his shift started, so he went to work. He didn't tell anyone about his symptoms, and he didn't think he would get anyone else sick. Unfortunately, the scenario you just imagined probably happens to someone, somewhere, every day. Did you know that 60% of food handlers have worked when they were sick? That's not all. 89% of people who worked while sick said it was their decision, not their manager's, to go to work. 40% of people didn't even tell their manager about their symptoms. According to one study, there are two main reasons food workers go to work sick. The first is that they don't think their illness will spread to others. The second reason is a sense of duty. They know if they call in sick, they may be leaving their coworkers short-handed. Another reason people might work when sick is that they can't afford to lose the hours. These are valid concerns, but so is protecting the health of the people around you. After all, how would you feel if you found out that the person who prepared your food was sick?
There are 4 symptoms you should always report to your manager, no matter how mild they might seem to you. They are vomiting, diarrhea, jaundice, and sore throat with fever. Your manager should let you know what to do to protect your coworkers and customers. Depending on your symptoms, you might be asked to stay home. Tell your manager if you've thrown up or had diarrhea anytime in the past 24 hours. Vomiting and diarrhea are common signs of several different foodborne illnesses and are very contagious. If your eyes or skin have a yellow color, that's called jaundice. Jaundice is a symptom of a serious liver infection that may be caused by hepatitis A. Hepatitis A can spread easily to customers through food. If you have jaundice, you need to stay home. Hepatitis A is that serious. A sore throat and fever could mean you're sick with strep throat, which is very contagious. Make sure to report that too. Nobody wants to get sick, so if you ever have one of these symptoms, please report it to your manager before going to work.
If you're diagnosed with or exposed to certain illnesses, your manager needs to know. They'll tell you if and when you can go to work. They might also have to share your diagnosis with the health department, especially if you primarily serve a highly susceptible population. These diseases can spread through food and are extremely contagious, so it's important for you to report them to your manager before going to work. Norovirus, hepatitis A, Shigella, Shiga toxin-producing E. coli, also known as STEC, Salmonella typhi, also known as typhoid fever, Salmonella non-typhoidal.
Infected wounds can carry pathogens like Staphylococcus aureus bacteria, or staph. If staph bacteria get into foods, they can make people sick. Let your manager know if you have an infected wound and keep it bandaged. If the wound is on your hand or wrist, cover it with a waterproof bandage and wear a single-use glove over the bandage. If the wound is on your arm, cover it with a waterproof bandage. If the wound is elsewhere on your body, cover it with a dry, durable, tight-fitting bandage. If you cut or burn yourself at work, immediately stop what you're doing and take care of it. Get a bandage and tell your manager what happened. If there was bleeding, throw away any food that may have become contaminated. Clean and sanitize your equipment and utensils. When you're done, wash your hands and put on a fresh pair of gloves.
As a manager, I want to know when my employees aren't feeling well. There are specific rules about how managers should handle certain symptoms, illnesses, and wounds. Remember, These guidelines are in place to protect you, your coworkers, and customers. Let's review when you should tell your manager you're feeling ill. I'll show you some symptoms, and you decide if they need to be reported. That's right. Because allergies are not contagious, you can go to work as usual. However, if you can't stop coughing or sneezing, your manager may assign you to work away from food. Remember to wash your hands frequently. You got it. Diarrhea is often a symptom of foodborne illness, so you need to report it to your manager. Your manager should ask you to stay home from work. That's right. Headache is not a common symptom of foodborne illness. If you feel well enough, you can go to work as usual. Great job! A sore throat with a fever may be a sign of strep throat, which can spread through food. You should tell your manager. That's right. Vomiting may be a sign of foodborne illness, so you need to let your manager know. Your manager should ask you to stay home until you've stopped vomiting for at least 24 hours. If you are vomiting due to a non-contagious condition, like pregnancy, let your manager know, as you may still be allowed to work. Remember, you always need to tell your manager if you are experiencing vomiting, diarrhea, jaundice, sore throat with fever, or an infected wound. If you ever have symptoms that you aren't sure if your manager needs to know about, go ahead and ask, just to be safe.